It may have taken a backseat yesterday with everything going on in Washington, but the COVID-19 pandemic is getting worse in many parts of the country right now. U.S. health officials expect things to get better quickly once much of the country has received their COVID-19 vaccines. But that's not going quite as quickly as many hoped. News Watch 12 Sierra Whaley joins us now live here in studio with the latest on the situation here in Wisconsin. Sierra.
If you're still wondering where and when you'll receive your vaccine, well, it's hard to tell with the system in place. The Wisconsin Department of Health Services held another news briefing today, providing more detail of where vaccines are located and why there's a delay.
56,000 doses that are not in the arms but have been shipped.
Wisconsin DHS officials say their first priority with the vaccines they do have is to get them to healthcare workers and those who are the most vulnerable.
This vaccine came out the week before Christmas, and so it was the week before and the week of Christmas that hospitals and healthcare systems were our priority.
So where are the dosages now, and why is it taking so long to get into Wisconsin?
105,000 of those were shipped this week. So on Tuesday, some of them hadn't even arrived.
Which explains why the state hasn't reached 70% of phase 1 vaccinations. DHS says the vaccine is taken in 2 doses, given a few weeks apart, and the federal government is asking them to store many of the vaccines they do have to make sure people can receive their second dose.
We're in transit, 105,400. That leaves about 51,000 that would be doses that are left from last week. And those are the doses that people are using to vaccinate this week.
Nurses have complained about not receiving their scheduled vaccination dates, and some have even traveled hours just to receive the vaccine. State officials made no comment on that, but share the shortage of supply has them frustrated as well.
We're only getting 70,000 doses a week. So you see what the problem is here. We don't have enough supply to open the gates much wider and be able to meet the need.
The department hopes to complete phase 1A within the next couple of weeks, and
I anticipate we'll be moving into phase B before the end of the month.
The DHS also says they're planning on deploying a mobile vaccination team from the state's vaccination task force. Back to you, Justin.